A few thoughts on yoga. Yoga, Pilates, weightlifting, running, that topic of conversation comes up a lot with patients, especially when we are returning to previously painful activities. Now, yoga offers many benefits, and on the whole, I have no problem with yoga. But like with any activity, what I'm thinking about primarily, not exclusively, but primarily, is the positions of the body when the person is doing that exercise. So taking away from the conversation or putting aside the conversation of yoga in terms of mindfulness or help with stress or with sleep, when we focus on the musculoskeletal system, my beef with yoga, if I have one, is that it can be predominantly forward bending versus backward bending, or of course, moving laterally. Now, yoga as a tool for musculoskeletal health is known for getting people into different positions and postures, which I love. I love getting out of the habit of just sitting in one position all day or sitting and standing and walking and actually twisting and moving backwards. But there can definitely be some yoga classes or instructors who have a penchant for doing more forward bending than backward bending. So downward dog, child's pose, in opposition to Sphinx or Cobra. And a lot of that forward bending can be to end range. So for the person with a healthy spine, should they be concerned about this? Maybe if you're someone who sits all day in flexion and you go to a yoga class and it's predominantly flexion of the spine and not extension, you may want to do some extension on your own. I think the average healthy person would benefit from adding some spine extension, such as neck extension, thoracic extension, lumbar extension into his or her life, even if it's just 5 or 10 repetitions a day. So it's something that could be on the radar for a person with a healthy spine. And I think yoga instructors sometimes, like Pilates instructors, often tell people not to get into end range extension when they're in Cobra, for example. Yet they do press a lot into end range flexion, as in child's pose or downward dog. And I don't really understand that discrepancy. If you're going to be comfortable with end range flexion of the spine, you should be very comfortable with end range extension of the spine. Spinal injuries are more likely to happen with flexion at the end of the day. So for the average healthy person, you might want to consider the amount of flexion versus extension versus lateral movements of the spine. Do I care about the extremities? Yes, but it's not a surprise to me that the majority of orthopedic disorders or people seeking care for orthopedic disorders have complaints in their neck and low back. So yes, I want people to think about their extremities, but that's much lower on the list. So for the person who has had a neck or mid-back or low back injury, however, and if that person knows that I have a trigger of lots of flexion, or I have a trigger of lots of extension, or lots of left rotation, whatever it may be, I want them to clock when they go into a yoga class if they're getting a lot of that movement that could be offensive to their system. And if it is, and they like that yoga class, well, usually they can remedy it by doing the movement that fixes them either before and or after the class. Or maybe they want to seek a different type of class. It's just about knowing what makes you worse or what you're predisposed to kind of getting injured with and making accommodations, either avoiding that, reducing that, or doing something opposite that before or after to keep your spine healthy. But at the end of the day, I have no problems with yoga, but I do look at the lens of movements. So just like if someone were going to say, I'm going to do weightlifting, and they name 5 different things and all of them are low back flexion, well, I would put forward to that person, well, maybe since you're doing all these strengthening exercises that also put your low back in flexion, you should consider moving your low back into extension as something that prevents injury possibly, or if someone has had an injury in the past, as something that maintains them in a pain-free state. So definitely consider yoga if that's something you like. Personally, it's not a favorite type of leisure activity or exercise for me. I prefer my exercise to be running and jogging and walking and weightlifting, upper and lower body. But for people who like yoga, I want them to be thoughtful about the positions that they're putting their body in, especially their spine, because too much of one direction may be a trigger for some people.